Hello, and welcome to Ask a Physical Therapist Intern. So, in this segment, I nominated four of my other co interns if they can explain a certain condition in 1 minute. And I have been nominated to explain on what is amputation. So, basically, amputation is a surgical removal of all or part of an arm or leg. It is mostly done to treat injuries, disease, or an infection. So, who is mostly affected from an amputation? So, patients who suffer from diabetes are at a high risk of developing ulcers and associated complications. Once a foot ulcer develops, there is a high risk of wound progression that may lead to complications and amputation. For diabetic patients, how can you prevent amputation? The first one is very important, which is a healthy diet. The second one is maintain healthy weight and blood pressure. The third one is check blood sugar regularly. Fourth one is taking insulin and other diabetes medication. And the fifth one, which is also one of the important things, is avoid forming ulcers in the foot. So as physical therapists, we also teach our patients how to do transfers independently or with a significant other so that it will be easier for them to move around the house. Besides transfers, we also teach exercises to avoid contractures, especially after surgery. Okay, so this is amputation in 1 minute, and I nominate Marielle to explain carpal tunnel syndrome under 1 minute.
Okay, Colleen, challenge accepted. This is carpal tunnel syndrome in 1 minute.
Tamar,
Pain on your wrist area?
It happens because of pressure on your median nerve, which runs the length of your arm, goes through a passage in your wrist called the carpal tunnel, and ends in your hand. A wrist fracture can narrow the carpal tunnel and irritate the nerve. Also, the swelling and inflammation caused by rheumatoid arthritis. So, burning, tingling, or itching, numbness in your palm, thumb, index, middle, and half of your ring finger. Weakness in your hand and trouble holding things. Keep your wrist straight while using tools. Gently stretch and bend hands and wrist periodically. Alternate tasks when possible. Even a few minutes each hour can make a difference. Incorrect posture rolls shoulder forward, shortening your neck and shoulder muscles and compressing nerves in your neck. This can affect your wrist, fingers, and hands. Make sure that your computer mouse is comfortable and doesn't strain your wrist. Avoid flexing or curling and extending your wrist repeatedly.
So, Sean, it's your time to do the...
Hi, I'm Sean, and this is low back pain in 60 seconds. Low back pain is defined as pain in the back between the ribs and folds below the buttocks that can radiate to the thighs, legs, and feet. 60 to 80% of the population experiences low back pain at some point in their lives. This is not a disease. It is a symptom that can come from a variety of causes. Most common causes are muscle strains, slip discs, spondylolisthesis, degenerative disc disease, and degenerative joint disease. We also have a list of red flags, and they are history of cancer, low back pain from 6 weeks to 6 months, no relief upon rest, accompanied by fever, pain worse at night, recent history of accident or trauma, numbness around the groin, and loss of bladder and bowel control. If you have these accompanying your low back pain, it is best to go see a doctor to screen for more serious conditions such as infections, cancer, and spinal cord injury. Here are a few exercises to prevent low back pain that you can do at home. Bridges, knee to chest stretches, low back rotational stretches, pelvic tilts, lateral leg lifts, and finally, cat stretches. We done. Went a little bit over 60 seconds, but I'm sending you now to Snides.
Coronary artery disease is also called heart disease and is caused by clogged arteries which block the normal blood flow. So it is quite similar to stroke. But while stroke is caused by blocked blood flow to the brain, heart disease is caused by blocked blood flow to the heart, which could lead to a heart attack. Common symptoms of heart disease are pain and tightness in the chest, jaw, abdomen, and left arm. There could also be exhaustion, sweating, nausea, vomiting, and fast beating of the heart. There are lots of risk factors such as family history and older age, which we do not have any control of. But there are also some factors that we can control, and the first one is high blood pressure. If you have high blood pressure, you should monitor it daily and take the medications prescribed by your doctor. Obesity is another high risk, especially if you have high cholesterol and diabetes. So avoid eating food with high cholesterol and high sugar, and instead have a balanced diet. Smoking releases toxins in the blood which can clog up the arteries. So if you are a smoker, slow it down a bit or stop and try to find other hobbies.
Lastly, having an active lifestyle, which is common to most of us, especially during this time. But just do some cardio every day, because the heart is a muscle, and the more active it is, the healthier it will be. That's 1 minute, and I nominate Jason to do this challenge.